3 in the morning. Your eyes snap open. Your heart is pounding harder than it should be for someone just lying still in bed. There's a strange flutter in your chest. Your left arm feels heavy. Your throat burns just slightly from something creeping up from your stomach. You tell yourself it's nothing. You turn over, try to fall back asleep, and by morning you've forgotten it happened. But your body hasn't forgotten. And if you're over 70, that 2 or 3 a.m. wake-up isn't random. It isn't stress, it isn't old age, it's a direct response to the side you fell asleep on. For decades, you were told sleep position doesn't really matter, that whatever feels comfortable is fine, that the body adapts. And until about the age of 65, that was mostly true. But after 70, the rules quietly change. The walls of your arteries thin in places you can't see. The valves inside your heart move with a little more effort. The drainage system that clears waste from your brain slows down. And one specific sleep position, the one millions of older adults default to without thinking, puts measurable extra strain on the aging heart every single night. By the end of this video, you'll know exactly which side cardiologists are quietly begging their older patients to avoid, why it matters more after 70 than at any other age, and the simple bedtime protocol that can take pressure off your heart starting tonight. Let's start with what you already feel. That heaviness in your chest when you lie down, the way your breathing seems just a little tighter when you settle into bed, the strange flutter that wakes you at 2 or 3 in the morning, the one you tell yourself is nothing, the dry mouth when you turn over, the acid that creeps up your throat, the numb arm, the racing pulse that comes out of nowhere. These are the things you've learned to dismiss, the little annoyances of getting older, the price of a long life. But these aren't random. They're not just age. They're signals, and every single one of them gets worse or better depending on which way your body is positioned during the 7 or 8 hours you spend horizontal each night. Most people assume the heart is a sealed, protected organ, that it sits in the middle of the chest, locked in place, doing its job no matter what. That's not quite true. The heart hangs. It's suspended inside the chest cavity by ligaments, vessels, and the surrounding tissue of the lungs. And like anything that hangs, gravity affects it. When you stand, it pulls down evenly. When you lie on your back, it spreads. But when you lie on your side, the heart shifts. It tilts. It leans into the side that's pressed against the mattress. And here's where it gets serious. When you lie on your right side after 70, that tilt does something subtle but measurable. It changes the angle at which blood returns to the heart. It compresses the inferior vena cava, the large vein that carries blood from your lower body back up to your chest. It alters the electrical rhythm of the heart itself. Studies on patients with heart failure have shown clear differences in how the heart performs depending on sleep position, and right-side sleeping consistently shows up as the position that requires more work from an aging cardiovascular system. You've probably been told the opposite. You've probably heard that the right side is the gentle side, the safe side, the side that's easier on digestion. And for a younger body, with strong vessels and an elastic heart, that's not entirely wrong. But after 70, the rules change. The body you have now is not the body you had at 40. And the side you've trusted may be the side that's quietly making your nights harder than they need to be. But here's what's really underneath that. The surface story is about the heart. The deeper story is about what surrounds the heart. The pressure inside your chest is a delicate balance. Your lungs expand and contract. Your diaphragm rises and falls. Your stomach, just below, presses upward with every breath. And when you lie on your right side, all of that pressure shifts in a very particular way. The stomach, with whatever it still holds from dinner, leans toward the esophagus. The lower esophageal sphincter, the small ring of muscle that keeps stomach acid where it belongs, becomes vulnerable. Acid creeps up. It irritates the throat. It triggers a cascade of tiny inflammatory responses that, over the course of years, weaken the tissue that lines your upper airway and your heart's outer covering. That nightly acid exposure has been linked in research to changes in heart rhythm, to inflammation markers that show up in blood work, to the quiet, slow thickening of tissue around the heart that nobody sees on a routine checkup. And it all begins with something as ordinary as the side you turn to when you pull the blanket up. Strip that back one more layer and you find something even deeper. Your body has a drainage system most people have never been taught about. It's called the lymphatic system. It carries waste, toxins, and cellular debris out of your tissues and back toward the heart, where it's filtered and removed. Unlike blood, lymph doesn't have a pump. It moves only when you move, when you breathe deeply, and when gravity helps it along. During sleep, when you're still for hours at a time, the position of your body determines how well that drainage flows. Sleep on your right side, and lymph from the left side of your body, including the area around your heart, has to fight against gravity to reach the main drainage point near your collarbone. Sleep on your left side, and that same lymphatic flow becomes easier. Fluid clears. Inflammation drops. The tissues around your heart get cleaner, lighter, less burdened. There's a reason traditional medicine systems across the world, from ancient India to old European folk practice, all converged on the same instruction for the elderly: sleep on your left side. They didn't have imaging machines, they didn't have cardiology textbooks, but they watched generations of bodies, and they saw which side led to longer, easier nights for older people. The science is finally catching up to what grandmothers always knew. That still isn't the real problem. The real problem is what happens when this position habit collides with the most overlooked organ in cardiovascular health: the vagus nerve. You've probably never heard a doctor talk much about the vagus nerve, and that's a quiet tragedy of modern medicine. The vagus nerve is the longest nerve in your body. It runs from your brainstem down through your neck, into your chest, wrapping around your heart, and continuing into your gut. It's the master switch for your parasympathetic nervous system, the system that slows your heart, lowers your blood pressure, helps you digest, calms inflammation, allows your body to repair itself overnight. And the vagus nerve is not symmetrical. The branch that influences your heart runs primarily on the left side of your body. When you lie on your left side, you create gentle, sustained pressure along the path of that nerve. That pressure, mild as it is, stimulates the nerve in a way that strengthens its tone. Higher vagal tone means a slower resting heart rate, a more variable, healthier heartbeat, lower nighttime blood pressure, reduced risk of the kind of midnight rhythm disturbances that send older adults to the emergency room. Lie on your right side and you do the opposite. You shift pressure away from the strongest branch of the vagus. The parasympathetic signal weakens. The sympathetic system, the fight-or-flight system, has a little more room to whisper through the night. Your heart works harder than it should while you sleep. Your blood pressure stays slightly elevated. Repair processes that should be deep and complete become shallow and incomplete. This is what cardiologists who pay attention to lifestyle medicine are quietly telling their older patients. They're not making headlines, they're not writing books about it. They're just leaning across the desk during a routine appointment, lowering their voice slightly and saying, "If you're not sleeping on your left side, start tonight. Just try it. See what happens." And what happens, for most people, is something they didn't expect. The flutter at 2 in the morning starts to fade. Not all at once, not the first night, but within a week or two, the strange wake-ups become rarer. The acid reflux quiets down. The morning blood pressure reading creeps lower. The numbness in the arm disappears because the arm isn't pinned under the heavy side of the torso anymore. The face looks less puffy when you stand at the bathroom mirror because lymphatic drainage worked properly while you slept. The energy in the first hour of the morning, the hour that used to feel sluggish and foggy, starts to feel different, cleaner, more awake, more yours. These aren't dramatic claims. These are quiet shifts, the kind your body has been waiting to make but couldn't because you were sleeping on the side that worked against it every single night for 30, 40, 50 years. Now, the position itself is only the beginning, because turning onto your left side without changing anything else only gets you part of the way. There's a full bedtime protocol built around this discovery, and it's worth understanding before you turn off the lamp tonight. It starts about 3 hours before you sleep. This is the window most people waste completely. They eat late, drink late, scroll late, and then crawl into bed hoping the body will just figure it out. After 70, the body doesn't have that kind of margin anymore. The last meal of the day should be light, finished at least 3 hours before lying down, and lower in the kinds of foods that lean heavily on the stomach. Heavy proteins late at night, fried foods, large portions of dairy, and refined carbohydrates all extend digestion well past the point where you should be settling into sleep. When you eventually lie down on your left side, you want the stomach mostly empty, so the heart and the diaphragm can move freely without competing for space. About an hour before bed, the room itself matters. Cool, dim, quiet. Not because it's a luxury, but because the body's nighttime systems were designed to switch on in response to falling light and falling temperature. The heart slows naturally in a cooler room. The blood vessels in the skin dilate slightly to release heat, which subtly lowers blood pressure in a healthy way. Sleeping in a room that's too warm forces the cardiovascular system to keep working at daytime levels for hours into the night, which is the opposite of what an older heart needs. Hydration is the next piece. Most older adults are mildly dehydrated by evening, and dehydration thickens the blood. Thicker blood means the heart works harder to push it through narrowing vessels. But drinking a large glass of water right before bed just sends you to the bathroom at 2 in the morning, which interrupts the deep cardiovascular repair phase of sleep. The solution is small sips spread through the evening. A cup of warm water with a pinch of unrefined salt about an hour before bed can help stabilize fluid balance without forcing a midnight wake-up. The body holds on to what it needs and lets the rest pass quietly. Then there's the magnesium piece. This is the part most people never get told. After 70, magnesium status drops in nearly everyone. The diet provides less of it. The kidneys excrete more of it. Medications that older adults often take, including certain blood pressure drugs and acid blockers, deplete it further. And magnesium is the mineral the heart depends on most for steady rhythm and relaxed vessels. A heart with enough magnesium beats calmly. A heart short on magnesium gets twitchy, irritable, prone to those middle-of-the-night palpitations that make you sit up in bed wondering if something is wrong. The form matters. Magnesium oxide, the cheap kind found in most drugstore bottles, barely absorbs. The body recognizes it, shuttles most of it through the digestive tract, and you get very little benefit beyond a softer morning bowel movement. The forms worth exploring are magnesium glycinate and magnesium taurate. Glycinate is gentle, deeply absorbable, and pairs with the amino acid glycine, which itself supports calmer sleep. Taurate pairs magnesium with taurine, an amino acid that has a particular affinity for heart tissue and has been studied for its supportive effects on cardiac rhythm. Taken about 30 to 60 minutes before bed, in modest doses appropriate for your situation, and discussed with whoever manages your medications, these forms tend to work with the body rather than against it. Now you're lying down. The room is cool, the stomach is light, the hydration is settled, the magnesium is on board. This is the moment of position. You turn onto your left side. Not the rigid, locked shoulder kind of left side that some people try to force, but a relaxed, slightly forward-leaning left side. A pillow under the head that keeps the neck in line with the spine, not bent forward or tilted back. A second pillow, smaller, between the knees, to keep the hips aligned and prevent the lower back from twisting during the night. Some people find a thin pillow held against the chest, almost hugged, helps stabilize the position and prevents rolling onto the stomach in deep sleep. Breathing is the final layer. Once you're in position, 3 or 4 slow, deep breaths through the nose, with the exhale slightly longer than the inhale, activate the vagus nerve directly. You're combining the physical pressure of left side sleep with the chemical signal of slow breathing, and the two together are far more powerful than either one alone. Within a few minutes, the heart rate drops, the shoulders soften, the mind quiets. The body begins to slip into the deep, restorative sleep phase that the older heart relies on for repair. There's something else worth knowing. Once you're asleep, you will probably move. You may end up on your back at some point. You may roll partially toward your right at another. That's normal. The body doesn't stay locked in one position all night, and it's not supposed to. What matters is the side you fall asleep on, because that determines the position of your body during the deepest, longest stretch of slow-wave sleep, which is the phase when most cardiovascular repair occurs. If you begin the night on your left side, your body will spend the majority of the most important sleep hours in that position, even if it shifts later. There's a small group of people who shouldn't follow this advice without medical guidance. Anyone with certain types of heart valve disease, particularly mitral valve issues, may find left side sleeping uncomfortable because of the heightened awareness of their own heartbeat against the mattress. If you've ever felt that pulsing sensation so strongly that it kept you awake, you may already know what this is. Talk to your cardiologist before changing your position habits. People recovering from chest surgery, lung procedures, or certain types of strokes may also have specific instructions from their care team that take precedence. This isn't a one-size-fits-all rule. It's a general principle that fits most older adults, and it's worth exploring with your own healthcare provider before becoming a strict habit. There's also the matter of expectations. The body doesn't transform in one night. The first time you try this, it may feel awkward, unfamiliar. You may wake up sore in the shoulder, or you may notice your heartbeat more clearly than you ever have. That awareness fades within a few nights as the muscles and connective tissue adjust to a new resting position. The cardiovascular benefits build gradually, over weeks. The lymphatic and inflammatory improvements show up over months. The blood pressure changes, the rhythm changes, the morning energy changes. All of these emerge slowly, the way real healing always does in an older body. If you've been listening this far, you already know this is one of the simplest, lowest effort interventions available to you. There's nothing to buy, nothing to swallow that you don't already have, nothing to schedule, nothing to negotiate with insurance. Just a quiet adjustment in how you turn when you pull the blanket up tonight, supported by a few thoughtful changes in the hours before sleep. And yet the cumulative effect, over a year, over 5 years, over the rest of your life, can be larger than most things your medicine cabinet has to offer. This is the kind of knowledge that should be common. It should be on the discharge papers when an older adult leaves the hospital. It should be in the brochures at the cardiology office. It should be in the conversation between every primary care doctor and every patient over 70. But it isn't. It lives in the margins of medicine, in the quiet conversations between doctors who pay attention and patients who ask the right questions. And now, it lives in you. If this changed how you see your bedtime routine, leave a comment with the word "left" so I know it reached you. I read every single one. And if you want more videos that pull back the curtain on the small, overlooked decisions that quietly shape how the body ages, subscribe and turn on notifications. This is the kind of conversation we keep having here, one quiet truth at a time. There's one more thing to understand before you go. The reason this matters so much after 70 isn't only about the heart, it's about everything connected to the heart. Every organ in your body depends on cardiac output. Your kidneys filter waste based on how efficiently blood reaches them. Your brain clears its overnight debris through a system that depends on steady, low-pressure circulation during sleep. Your muscles repair, your bones rebuild, your immune system patrols, your endocrine glands recalibrate, all of it dependent on the quality of the work your heart does between the moment your head hits the pillow and the moment you open your eyes the next morning. When you choose the side you sleep on, you're not just choosing a comfort position. You're choosing how hard your heart will work for the next 7 or 8 hours. You're choosing how clean your lymphatic drainage will be. You're choosing how well your vagus nerve will be stimulated. You're choosing whether stomach acid will sit quietly or creep upward. You're choosing how deeply your blood pressure will drop into its healthy nighttime range. You're choosing how much repair your tissues will accomplish before the sun rises. That's a lot of weight for one small decision. And it's a decision you get to make again tonight, and tomorrow night, and every night after that. Most people will never hear this. They'll keep sleeping on whatever side feels familiar, never connecting their morning fatigue, their nighttime palpitations, their slowly rising blood pressure, their stubborn brain fog, to the position they've held for thousands of nights in a row. They'll spend money on supplements that try to compensate. They'll add medications that try to manage symptoms. They'll wonder why nothing quite gets them back to the way they used to feel. You're not going to be one of those people. Because tonight, when you pull the blanket up, you'll turn to your left. You'll rest your head. You'll feel the slight, almost imperceptible difference in how your chest settles. You'll take 3 slow breaths, and you'll let your body do what it has been waiting decades to do properly. There's a kind of quiet revolution that happens when an older body finally gets the cooperation it's been asking for. The heart softens, the breath deepens, the mind clears. The years feel a little less heavy. Not because anything dramatic has changed, but because something fundamental has finally aligned. The side you sleep on after 70 is not a small thing. It may be the most important conversation your body and your bed have ever had.